All right, we will go ahead and get started. Good morning, everybody, and thank you for joining us today. I am Cheryl George, back in the saddle once again to be your host for today's session. We are here to discuss cardiovascular and heart health solutions available to your members. I don't think it would come as a surprise to anybody that heart health is a very hot topic at the moment, but I do think the prevalence of heart health and cardiovascular conditions would be a bit of a surprise. According to the North Carolina Division of Public Health, heart disease is the second leading cause of death among North Carolinians. And nationwide, the CDC estimates that 48% of adult Americans have hypertension. 48%, that is nearly half of our population. It is a real concern, and it's one that we are aimed at helping our members manage through two specialty solutions that we have showcased today. So before I introduce our expert presenters, I will review just a few quick reminders. As always, this webinar is being recorded. We'll provide a link to all of the registrants after this session in a follow-up email later this week. If you have a question at any point throughout the webinar, please use the Q&A feature, not the chat. We have some experts behind the scenes to answer any questions, and we will leave some time as well at the end. And then lastly, at the end of today's session, a survey will pop up in your browser. We use your feedback on the survey to develop future webinars, both in terms of topics as well as content and how we engage with you. So your feedback on these surveys is very important. As an extra incentive, we are offering a drawing to win a $25 Amazon gift card. So your survey is your ticket into that entry. So please keep a lookout for that. Here with me today, I have three presenters, Brendan O'Hara, Lauren Baker, and Fran DeYoung. Brendan is the Manager of Professional Pharmacy Engagement and Quality here at Blue Cross NC. He began his career in community pharmacy, working in various positions from staff pharmacist to district pharmacy district pharmacy manager. He has been with Blue Cross North Carolina since 2015 and currently manages a team working on value-based programs, implementing pharmacy programs in health systems, provider groups, and most recently, community pharmacists. Lauren is a senior manager of solution strategy with Teladoc Health. She is experienced with client sales and solution strategy with a 7-year tenure at Teladoc Health. She sees teamwork and collaboration as powerful tools for improving health and wellness for members everywhere. And last but not least, we have Fran DeYoung. Fran is the Southeast Regional Vice President with Teladoc Health. He is experienced in managing large market accounts with a 6-year tenure at Teladoc Health and a strong background before that at Virgin Pulse. He is passionate about making an impact in telehealth space, and we are very glad to have all three of you here with us today. So thank you all for joining.
Sure.
All right, so let's kick things off with a poll question to start. What percentage of adults diagnosed with hypertension or high blood pressure currently have their blood pressure under control? So we'll pop that up in the chat and we'll give you just a moment to review that. And I still see some answers popping in, so we'll give it just another moment. And let's take a look at the answer. The answer is B, 20%, according to the National Center of Health Statistics in a study conducted from August 2021 to August 2023, so over the course of 2 years. They found that 20.7% of adults had their blood pressure controlled to less than 130/80. To put that number into perspective, that is 1/5 of diagnosed adults. Just 1/5 have their blood pressure under control. So that's a staggering statistic, and it is statistics like those that spur conversations like these, offering programs to your employees to help manage their cardiovascular health so we can hopefully grow and expand that 20% statistic. And that brings us to our first offering that we have today to spotlight. It is a new pharmacy offering for our fully insured members aimed towards members with diabetes and hypertension. Brendan, would you mind kicking us off and telling us a little bit more about More Than a Script?
Absolutely, Cheryl. Thanks everybody for attending today. As Cheryl shared, I do have background in community pharmacy, so I am really excited about the program that we were able to launch, and even more excited for the opportunity to be able to share with you some information regarding our program, More Than a Script. More Than a Script really is an innovative program that's been years in the making. So it's grounded in the fact that pharmacists are trained to provide education to patients on chronic care management. Pharmacists traditionally only get paid on products they dispense and not for the cognitive services and knowledge that they share with patients. This program really looks to change that and reimburse pharmacists for those cognitive services as opposed to just for those dispensing roles that pharmacists have traditionally had. So what do we do with this program? So we identified 100 independent pharmacies throughout North Carolina, from the mountains to the coast. There's a really strong body of evidence that I encourage you to kind of look into that really shows that the knowledge and accessibility for pharmacists make them uniquely positioned to improve both outcomes in patients and improve financial benefit for chronic disease state management. Our goal is 10,000 enrolled members who have uncontrolled diabetes and or high blood pressure to push to the pharmacist so they can improve outcomes in those patients. The program is primarily made up of fully insured commercial members, approximately 85%, and that's including ACA, and about 15% is our Medicare line of business. And really kind of thinking a little bit more about what is More Than Script, how did we do it? So we really worked with our internal team of pharmacists, our technology vendor DocStation, as well as our pharmacy advisory group made up of pharmacists from schools of pharmacy, state pharmacy associations, and innovative pharmacists already doing work like this to help us identify the best pharmacies positioned to help us attain our goal. And we also focus on rural populations and social drivers that may inhibit members from getting the care they need and integrate those into our protocols. So as this slide says, why pharmacists? As previously mentioned, pharmacists are underutilized in healthcare today. Patients see pharmacists significantly more than most other healthcare professionals. Pharmacists receive 6 years of training of disease state management, how medications can improve them, and most importantly, much of that training is how to directly educate patients and interact with patients on improving their own health. Because of this, it's really important for pharmacists not only to practice at the top of their license, which is a catchphrase we use often, but recently I heard really trying to get pharmacists to practice at the top of their training. Again, more aligned with that 6 years of skills and experience they've developed. By focusing specifically on independent pharmacies, we really emphasize our commitment to local communities, meeting members where they are. On the next slide, when we talk about clinical protocols. So our clinical protocols are the foundation of the pharmacist-patient interaction. As my team personally developed this, we have a team of pharmacists internal to Blue Cross Blue Shield in North Carolina. And my team actually developed these, and we really wanted to make sure they followed current guidelines and drove outcomes that were supported by by that literature that I previously mentioned. It was also important to visit patients to make these visits easy for the pharmacist to document. In many instances, and this might surprise you, those pharmacist interactions can last as much as 30 to 60 minutes. So we wanted to streamline the process to not have another 30 minutes of documentation for that. So the clinical protocols are meant to really drive the outcomes for those patients, but also be an easy way for the pharmacist to document what those interactions are and set up future states. Once we developed those protocols, we really worked with our pharmacy advisory group to make sure our process was clinically sound, and then we integrated it into that vendor technology platform, DocStation. Next slide, please. The protocol design. This is really the meat of the program. So for diabetes, there are 6 separate visits that a pharmacist would have with a patient to help improve the outcome of their disease state. For hypertension, it's 4 separate visits. And again, it starts with doing a baseline assessment. Do they know their medications? Do they know what's going on? Have they had their A1C drawn lately? Do they have a recent blood pressure? So again, all those things that really are baseline to show the improvements, pharmacists are doing in that first visit. And then the next 3 to 4 visits really are just sharing data and information for patients on the outcomes, on the desired long-term effects of the disease and how we can prevent some of those long-term effects of the disease by managing it and understanding it and controlling it earlier in its state. It also was important to make sure that we wanted to help pay pharmacists for some of the additional services, those optional add-ons, were really different things that would help in support of the program that they're doing. So items like compliance packaging or medication synchronization are different things that the pharmacist could be doing in there to help further achieve the outcome. And really the whole goal of this program is meant to get members who are uncontrolled to controlled. And so diabetic, it's defined uncontrolled as a diabetic patient having an A1C above 8%. And for patients living with high blood pressure, the goal is below a blood pressure of 140 over 90. So on the next slide, so a lot of what we've talked about today really looks at the protocol design, the pharmacist interacting with the patient, but it's really important not only that the pharmacist is talking at or talking to or talking with the patient, but that the patient becomes an active part of the process. So while the pharmacists are managing most of the conversation, we really know it's important for the members to be active and participate. So there are some key questions patients can ask to ensure they are knowledgeable as well. Again, one of the big things is, what can I expect from taking this medication? Are there side effects to this medication? Can you show how to use my blood pressure cuff? How can I check my own heart rate? What kinds of exercise are safe for me? And then what do my numbers mean? Again, all of these are things that the pharmacist could review with the patient, but there's also opportunities for the patient, again, to be active in those conversations. Ask the questions that really are probably really important to the patient they may not think to ask or are afraid to ask. This time is meant to have the opportunity for them to ask all of those questions. And so all that being said, what is it, what is the outcome? We rolled out this program June of 2024. We were able to, through June to December, we were able to enroll 100 independently owned pharmacies in the More Than a Script program. By December of 2024, we had 165 patients that were able to be engaged. This accounted for over 260 appointments with those patients, if you think about those protocols in the 4 to 6 appointments. So 260 appointments were held with those patients by December of 2024. And the best information here is that the members actually were able to, the pharmacist work was able to get 21 separate members to goal by the end of the year. This accounts for, again, 21 members having the knowledge and abilities to be controlled and manage their disease state, but it also accounts for about $40,000 in savings just from those patients getting to goal. All that being said, really would love for you guys to take a minute and watch this video that I think really takes the entire pieces of information that I just shared and really drive it home as far as the message of how important some of this work really is.
In rural North Carolina, it can be really challenging to, number one, find a doctor, much less get to that doctor's appointment. Most people see their pharmacist at least 12 times a year. They're coming into the pharmacy every month to pick up their medications, so it's a familiar face. More Than a Script is a program that was developed by Blue Cross Blue Shield of North Carolina to help patients better manage their high blood pressure and diabetes. This program just gives us the opportunity to sit down with patients and answer their unique questions. I can be there to help supplement what they've learned at the doctor's office. I have the time and ability to do it, and I'm right down the street from them when they need to meet. What I want them to understand is what changes they can make to live a healthier and more high-quality life. Blue Cross and Blue Shield of North Carolina cares, and this program proves that.
All right. Thank you, Brendan.
In rural North Carolina, it can be
Quick tech glitch. There we go. All right. Thank you, Brendan, for that insightful look at the More Than a Script pharmacy program, and particularly that patient impact video that you just shared. It's always great to see how our programs can directly impact patients and how to make healthcare more accessible and ultimately better for all, which is a goal that we have here at Blue Cross NC. Before we take a look at our next solution, it is time for another poll question. What conditions can be associated with uncontrolled hypertension? We have stroke, vision loss or decline, chronic kidney disease, or all of the above. So we'll give you just a moment to answer that one. We have some answers that are coming in so far. And the answer is D, all of the above. So I know I personally, when I think of hypertension and heart disease, I think of stroke, but actually, oh, give me just a second, y'all. All of the above are applicable to those, including additional ones by, excuse me. Oh, sorry about that, y'all. The Mayo Clinic also lists all of these as well as others, including cognitive decline, dementia, preeclampsia, and more as conditions that can be associated with uncontrolled hypertension. So those are personally, I think if we can find a way to reduce or take any steps towards reducing or managing any of these conditions, that is a step worth taking, in my opinion. I believe that you and your employees would likely agree as well. And that brings us to our next solution for our self-insured and balance-funded employers. We work with Teladoc Health to offer the Chronic Condition Management Plus program, which has a focus aimed at members dealing with hypertension. Fran and Lauren are here to provide more detail. Fran, would you mind telling us a little bit more?
Absolutely. Thank you, Cheryl. Good morning, everybody. My name is Fran DeYoung with Teladoc Health, and we're really excited to take this next 20 minutes and talk about our hypertension program and our partnership back with Blue Cross Blue Shield of North Carolina. If you go to the next slide, Cheryl talked about at the very beginning that 48% of the US population is dealing with hypertension, which is kind of a staggering number. We look at it and kind of some of the data on the left-hand side kind of slices it in a little bit different way. We recognize and see that every 33 seconds, somebody passes away from cardiovascular disease in the US. The one that really kind of shocked me, but really kind of opened my eyes a little bit more was the bottom one. 1 in 5 individuals have a heart attack, but they don't even know that they had it. And I've personally experienced that with a coworker. And it's something that really rings true to me, having that coworker deal then with hypertension and the long-term impacts of that. So we're here today to talk about our hypertension program. It is American Heart Awareness Month. And we partner with Blue Cross to create awareness around hypertension for folks. I'm going to talk a little bit more detail about our engagement center, but we provide materials in conjunction with Blue Cross Blue Shield of North Carolina to talk about a healthy lifestyle and some of the elements or aspects to be able to sustain that longer term. We currently integrate with the Blue Cross North Carolina's the case management team. And we'll talk a little bit more detail in terms of that and be able to refer people there. We also provide various ways to, again, create awareness, whether it's social media, blog posts, for individuals to kind of, take a look at it and read. And through our virtual primary care, which we offer it through Blue Carolina, we're not going to talk about it today, but 1 in 4 diagnoses for hypertension are new diagnoses. So again, speaking to the people that weren't even aware that they had hypertension previously, here's a program for those individuals to kind of help manage it. And we call it Hypertension Management Plus. So if we go to the next slide, Julie, here shows the overview of our cardiometabolic suite of solutions. We offer diabetes, prediabetes, the hypertension, weight management, supported with mental health. These are all available through North Carolina, but we're going to focus on our Hypertension Plus program. And that Hypertension Plus program really provides the tools and some of the technology, which we'll get into, but also provides coaching and content relevant for that individual trying to manage their hypertension. I think Brendan talked about, for folks that are on out of control range for their systolic and or diastolic blood pressure, it's getting them below that 140/90 threshold. Right? And we'll talk about some of the tools that we have to be able to do that. In addition, go back, not quite yet. If you would, thanks. Our hypertension program, the reason why we call it Hypertension Management Plus is it also supports those individuals that are living with diabetes. We know that there's a certain percentage of folks out there that are what they call comorbid. They're dealing with multiple conditions. So for those that are diagnosed with the claim of diabetes and hypertension, we can help support those members as well. So again, we'll be able to support more than just the hypertension condition alone. Similarly, there between 65 and 75% of the folks that are dealing with hypertension are also dealing with weight management. Here's where our weight management program will come in and help support those individuals as well. So you're getting, multiple conditions addressed through our Hypertension Plus program. and we'll get into a little bit more detail. So now I think, Cheryl, Julie, you can go ahead and go into that. And so we'll talk about, go to the next slide, our Hypertension Plus program that I just mentioned. With our Hypertension Plus program, folks, when they sign up for the program, within 3 to 5 days, they are going to receive a blood pressure cuff. And that cuff has multiple cuff sizes that the member can choose what's appropriate for that individual member. They'll also download the Teladoc app. And when they download that app and when they receive their blood pressure cuff, that blood pressure cuff is cellularly enabled. So it automatically connects to their app on their phone. So they take a reading, that information is immediately uploaded to their app. And from there, we're able to provide content, healthy habits, tips and nudges to help those individuals kind of better manage and get that hypertension, get that reading down into a controlled state and maintain that controlled state through the use of the blood pressure cuff, through the use of the app, through the engagement with our coaches that we offer. It's very easy to read the information and educational. It's really provided at a very 5th grade level. And the information is very bite-sized. Think of it almost like a Instagram or TikTok, where you can kind of grab the information. It's readily accessible, actionable, and then you move on. Because the goal here is to get people to live their best lives and be able to manage their hypertension. We'll provide a Drive for 5 campaign. Really what that is we want to get people within the first 30 days to check their blood pressure 5 times to create that habit of whether it's weekly, bi-weekly, or once a month. People are engaging with the cuff, but we're also going to be able to send out various nudges and communications via the app and push notifications for those individual members. We'll provide heart-healthy recipes and recommendations for appropriate diets for those individuals. And we follow the AHA guidelines around healthy heart health. On to the next slide. It's one of the elements, and it's a really important element that we use in conjunction with the blood pressure cuff, is access to our coaches. Our coaches are available for those individuals for live sessions over the phone. They can do texting messages back and forth, asynchronous text messaging back and forth with their coach. They can maintain that relationship with that coach on an ongoing basis. And that personal interaction, the suggestions, the recommendations, the guidance from that coach is really important to help kind of solidify and reinforce the right behaviors. Topics around medication, diet, activity, lifestyle, really around that behavior change, that's really key for those folks. And that's where the coach really kind of comes in. All our coaches are Teladoc W-2 employees. All are highly qualified with various certifications around hypertension, diabetes, and wellness coaching. And the feedback from our members is very positive. The members feel that coaching really does kind of create that connection and link and really helps those individuals maintain that on an ongoing basis. The next slide, if you would, I'm going to turn it over to my colleague, Lauren, to go through some of the details on our hypertension program. Lauren?
Yeah, thanks, Fran. So I'm just going to talk about some of the outcomes that we see clinically from members who are using this program. And first, we're going to start a little broader with our entire membership base. So this is nationwide. So overall, in the years since we've launched this program in late 2018, early 2019, we have seen great reductions in diastolic and systolic blood pressure, and of course, the cost savings that comes along with that. So we see here that 13 millimeters of mercury average reduction in systolic blood pressure after 1 year. So every point that we can reduce our systolic blood pressure, especially, that's a one that we pay a lot of attention to. We are seeing reduction in those instances of stroke and heart attack and other cardiovascular disease. So the more that we can bring this down, even 1 point at a time, the better. So seeing over 10 points in there nationwide on average is a huge boon to not only our members, but also our clients who are fielding those costs. We see a 5-point average systolic blood pressure reduction extra for each additional additional program enrollment, which is important as we talk about our full suite that Fran was showing earlier. The more that we have these different chronic condition management programs available in tandem, like the weight management program, for example, which I will sort of put a plug in there. I know we just saw the device for our hypertension program. The weight management portion of this program does include a scale. So just like we have the connected blood pressure monitor, we also have a connected scale, cellularly uploads just like that. So makes it easier for members to use. And the more they use these multiple programs together, the additional benefit does play out in not only their weight, but also in their reduction of blood pressure. And of course, that cost savings on the right with $76 per participant per month savings from members who are on our hypertension program. So if we move to the next slide, we'll talk a little bit more specifically about Blue Cross NC. So these are clinical outcomes for specifically clients through this partnership. So we've got our systolic and diastolic blood pressure reductions on the left there. So our starting baseline, that baseline is what we get from that Drive to 5 campaign. So we do have real data to back that up, which is awesome. We're not just sort of guessing. And we can see that we have a 6.3 millimeters of mercury reduction in systolic blood pressure on average, and then a 4.9 millimeters of mercury reduction in diastolic blood pressure. So seeing those come down at 6 months plus. And of course, we actually report this on a client basis. So when our clients partner with us, we are able to report out on this clinical data we have a snapshot that we can send every month. And then we also have additional more in-depth reporting that looks more like this for business reviews that can be quarterly, biannual, or annual, depending on your needs. So, and then on the right side, we have the movement in the population. So I like to say, the left side is sort of showing our incremental, how it sort of stair steps down. And then on the right side, we're seeing how people are moving from risk buckets, how they're sort of stratifying out. The red bucket is stage 2 hypertension, as indicated by the red, not where we want to be. So we're trying, in essence, to have less people in those yellow and red buckets and more in the green bucket. And that's exactly what we're seeing at 6 months plus on the program. So from our baseline, we're seeing about 24.7% are in the controlled range, and then 27% at the 6 month plus range. So we are getting people, sort of moving them out of those risk factors. And I especially look at that stage 2 hypertension. That's where we can get, that's really not well managed hypertension that we're really looking at with a hard eye to try and get a handle on. We see that going down from 44.6% to 36.5%. So still moving them down that spectrum of hypertension disease state. And then 76% of members have maintained or improved their blood pressure control on this program, which I think is a great overall metric to show. Sometimes we get caught up in like, oh, it's less than 10, but every point counts, and the amount that people are able to maintain or improve is a huge identifier of not only people are using the program, but they are finding benefit from it. If we go to the next slide. This is another slide again that is Blue Cross NC specific, and this is device monitoring. Again, this is a slide that we would show per client. So if as a client partner, this is something we would be able to show you in your business review data. And this is about checking behavior because, of course, how are we getting all this data on blood pressure? We know because we're actually using the device. It's not self-reported, it is coming in from that biometric data. So we have at least 28.6% of the membership across Blue Cross NC is checking 4 or more days a month. And I know sometimes when we look at that bottom bucket, that 57.1% that are checking at less than 1 day a month or 1 day a month, then we are like, oh, that's only 1 day a month. But if you think of how often you take your blood pressure, maybe as someone who is or is not living with hypertension, it's less than that, right? I can't remember without this program the last time I would take my blood pressure. Maybe when I would go to Walgreens and stick my arm in that machine, which I'm not even sure they have anymore. So getting people to check even 1 time a month still gives them better advice. They can be using the program outside of this. And again, this is a great way for us to be able to monitor how the population is doing. But I really like the right side here, where we're seeing that members who've checked their blood pressure in the last 90 days have, on average, been taking it at least 10 times in the last 90 days. Our active 30, so 43% of the population who have used it for the first time have used it in the last 30 days. And then the Drive to 5, which Fran talked about earlier, 64% of people who have used the meter at all have successfully logged those first 5 blood pressure checks. So effectively completing that baseline from the beginning. So we do see some really great participation in that as well. All right, Fran, I'm going to hand it back to you to talk about some engagement.
Thank you, Lauren. So what we've gone through is relatively quickly kind of an overview of what the program looks like and some of the data supporting it. One of the key aspects of it is creating awareness of the program. And we provide access to our engagement center for members. And some of you may already be using the engagement center to kind of pull different content down that's applicable. But one of the things you kind of see here on the right-hand side, some of the different tools that are available. Emails, flyers, there's banners that are available both in English and Spanish that are appropriate for members. And we also, you see at the very bottom, provide a toolkit, right? Information around, as we're in the middle of Healthy Heart Month in February, data and content that's available that's appropriate for individuals. So the engagement center, think of it as a resource center of media where you can go in and pull different pieces of content, be able to share them again via an email, via posters and whatnot, accessible for individuals and clients such as yourselves. If you go to the next slide, and I think we have time for this, is also available on the Engagement Center are videos. So these are great if you have the ability in a break room to share videos, the TV screen, kind of have this play, or even in the hallway in some organizations, be able to kind of send out these videos. And if we look at the Dan video on the right-hand side, Julie, I don't know if you can click on that. I think we have time. It's just a quick 2-minute video. It's a really great overview of the Hypertension Plus program.
Teladoc Health has been very beneficial, very effective. Hi, I'm Dan, and I'm a Teladoc Health member. I first became aware of Teladoc Health through my retiree health program. It was suggested that I use it for monitoring my cardiac condition and my weight. After being a first responder for 35 years, I knew that maintaining my health was very important to me. I wanted to make sure that I could stay in as good a shape as I could for as long as I could. This was a perfect way for me to keep track of things. I developed a procedure where I wake up every morning, I weigh myself on the scale, and I take my blood pressure. Anytime I note any deviations in my blood pressure, or anytime that an event occurs that I wonder what my blood pressure status is, I don't hesitate to take out my Teladoc Health monitor. I own the house across the street, and I was doing some remodeling on it. I woke up the next morning, went through my routine, and my blood pressure came out at about 109/91. That's not a good blood pressure. My pulse, according to the meter, was somewhere around 160 or 170. I could tell exactly what was going on inside of me. Keeping track of my cardio status is second nature to me now. Through the app, I have ready reference to today, yesterday, last week, last month, last year, all of the information I want. My doc looks at my Teladoc Health records. I've got 4 or 5 years of daily records. He's able to monitor my cardio health and my weight very closely, and they can look at the trend of it. It proved to me that something was wrong that I had no other way of knowing. Nothing else told me I was going wacko inside. Teladoc Health and monitoring my blood pressure did that for me.
All right, that's a fantastic video, and you can kind of see here and hear Dan talk about the fact that he's leveraging both the blood pressure cuff and the weight scale to kind of help manage both those conditions for him. And again, all that data, whether it's from the scale, whether it's from the blood pressure cuff, all cellularly enabled, all uploads immediately to that individual's app, and they're able to kind of then share that information, as he mentioned, share that with their physician, and really put that plan together going forward. So perfect. So the last slide that we have here is the value of Teladoc and Blue Cross Blue Shield is numerous. We make it very easy for clients to sign up for the Teladoc program and implement the program. It's very turnkey from our perspective. We're able to do claims-based billing through Blue Cross of North Carolina. And we're also being able to identify clinically identify those eligible members to be able to target market to those folks. So we're very specific in terms of what that marketing looks like, and really kind of target those folks that have a hypertension claim for the program. We also provide monthly reporting. Some of the nudges that we talked about and the tools that we provide are all part and parcel of the program that we provide through North Carolina. And again, I think at the end of the day, it's a very simple, easy to use program that really does benefit your members. And I think, in conjunction with the Blue Cross team, be able to kind of make it turnkey, provide the data, and really kind of help those individuals living with the chronic condition of hypertension. So with that, I think I'm going to turn it back over to Cheryl for some final comments.
Awesome. Thank you both, Fran and Lauren, for that fantastic overview of the CCM Plus program with Teladoc Health and how it can help members living with hypertension. So today we featured 2 programs focused specifically on cardiovascular support and management. Here you can see that we have a full suite of solutions available. Highlighted in light blue are offerings specifically focused on cardiovascular health. In green, you can see some of our newest offerings for the 2025 health plan year. And in dark gray are some solutions that don't necessarily target cardiovascular health specifically, but can help aid your members in their health and wellness journeys as they focus on heart health. A few of my personal favorites that I'll take just a moment to highlight: our nurse support program, Condition Care, works with members who have hypertension, coronary artery disease, or CAD as you may see it, and congestive heart failure. Primary 360, which is one of our newer offerings for 2025, offers a virtual primary care provider, PCP, and provides a free blood pressure cuff for those who engage with a virtual PCP. So in addition, we also have nutrition counseling as part of the whole Primary 360 program. Registered dietitians can help members learn how their diet impacts their heart and cardiovascular conditions and get some help with that. And then, of course, we have our wellness newsletters, which I hope you are all already receiving. Our February newsletter also highlighted heart health this month and provided additional details on all of the programs listed here, including links to videos and supporting materials that you can use to educate your members. If you're unfamiliar with our wellness newsletters, you can access those through the News You Can Use section on the agent and employer portals, or you may be provided them directly from your sales team, either one. If you have any questions, please feel free to reach out in the survey. If you're interested in learning more about any of these healthcare programs, reach out to your authorized agent. They'll be more than happy to help you with that. I did go ahead and prepare our next slide for Dental and Vision Health. We received a lot of questions in our registration and then again today in the Q&A, so I'm glad I had this ready. People were wondering if dental and vision health and if that could or how it could affect cardiovascular health as well. The short answer is it absolutely does affect your heart health. As you can see illustrated here, by having at least one preventive dental visit each year, members with diabetes and or coronary artery disease had significantly reduced medical costs. A few other interesting facts that I'll leave you with: people with gum disease are about twice as likely to have a heart attack. There is research that suggests that heart disease, clogged artery, and stroke may be linked to inflammation and infections that oral bacteria can cause. And early signs of over 100 different diseases can be spotted during an eye exam. I learned that in preparation for this webinar, and I actually made an appointment to get a vision exam because it's been quite a while since I've had one. So real quick in the chat, I'm going to link our webpage for dental and vision to learn more. I really encourage anyone that's interested in learning more about the dental, vision, and heart health connection to visit that page. And of course, your authorized agent can help provide more details should you have any. Let me add that here to the chat real quick, and then we will move into some Q&A. The Q&A is still open if you have any questions at the moment, but we'll go ahead and address some of the ones that have popped through already. Brendan, we'll start with you. You mentioned focus on rural communities during your presentation. Someone asked if you would mind expanding on that just a little bit.
Yeah, definitely know that there's a lot of opportunity in our rural communities for focus on both diabetes and hypertension, just a lot of inequities in those areas. So we actually, as we were rolling out the program, we actually met with our internal teams for health equity and just try to say what would it look like to provide some focus. So of those 100 pharmacies, we actually held back 10% of them, so 10 separate pharmacies in rural communities of need. And so we were able to have 10 pharmacies in those communities specific to try to counterbalance some of those inequities. So as we expand the program, that is something that we hope to continue to work with our internal teams to find out other areas, if we expand to other disease states, other areas that we might be able to do. So really, we're lucky that as an organization, we have a lot of focus on that, and we have the resources where we can go right to a team, say where might there be some areas of need, and be able to immediately get a list of counties, and then find pharmacies in those counties to be able to help support those needs.
Awesome. Wonderful. It's great to hear how we're sort of expanding all of that to provide greater access for healthcare. So that's a great mission, and I'm glad that we're able to achieve that. Fran, I do have a question for you. Are there any metabolic conditions that Teladoc Health supports aside from hypertension? I think we mentioned a weight management one. Maybe there's some others floating around. Would you mind speaking to that a little bit?
No, that's a great question. And through, our partnership with Blue Cross Blue Shield of North Carolina, we offer, in addition to the weight management, also our diabetes management program, our diabetes management plus program, and our pre-diabetes management plus program. So with our diabetes program, like you saw with hypertension, where you get the blood pressure cuff, with diabetes, you would get a glucometer and a separate kit for that. We could probably do a separate whole 20-minute segment on that one. But again, similarly, you access to the coach, support with the coach, and it's a model where we're leveraging the data from the glucometer, managing A1C. And I think Brendan talked a little bit about, some of the A1C data as well as the hypertension being in control. The goal is to get it in control range. We also do a program, our pre-diabetes program. It's a CDC approved Centers for Disease Control, for those what that acronym stands for, approved program where there's a series of steps that individuals would kind of go through in order to kind of reduce and get away from the diabetes road track that they would be on, really to kind of help them manage their weight, help them with healthy habits and behavior change through the pre-diabetes program. Lauren, anything else that I may have missed there?
I think you got it all. And the digital mental health, if you didn't.
Yeah.
Mm-hmm.
Definitely a great overview of all things chronic condition management, for sure.
We can support.
Awesome. Lauren, I believe earlier that you spoke to the blood pressure cuff and weight scale. At least, I hope that was you, but I'm going to tee it up to you anyways. A participant was wondering if you needed Wi-Fi in order to use and track that data. Is Wi-Fi necessary by chance?
Yeah, great question. It is not. So all devices that Fran just mentioned as well, so the glucometer, the blood pressure monitor that we showed, and the scale are cellularly connected. So not using a member's cell plan either. They have their own SIM cards. They upload seamlessly onto the strongest cell signal in the area. So no need to have Bluetooth capable devices or Wi-Fi where you are using these devices. They will upload through that cell connection. You also don't need to have a smartphone to use these programs. Anywhere you can access a web browser, we have a fully functional web portal that has everything you'd see on the app. So you can just use that if you'd prefer, or don't have a smartphone if you'd prefer not to use it.
That's awesome. So again, a great offering for participants who are in like a more rural area that maybe don't have like direct access to Wi-Fi or smartphones or things like that. Awesome. Brendan, I'm going to jump back to you. Are there any plans at the moment to expand more than a script by chance? Any sneak previews you can give us?
Yeah, so obviously diabetes and hypertension are some of the big things to continue to expand. So even within those, we're looking at other populations that we could do that. So is there other groups that would be interested in adding that? So for 2025, we are looking at expanding the target population. I specifically said commercial, fully insured, ACA, and Medicare. We're looking at expanding that in 2025. We're also looking at, the independent pharmacies are a big part of kind of what's happening in the community, and it's really a strong focus for us. We're also looking at, okay, is there a way with a single footprint to get a larger organization? So we're having some conversations with larger organizations. So if we look at it, we would be like additional populations, additional footprints of pharmacies. And then in North Carolina, probably a little bit kind of off track from this, but in North Carolina, there's a House bill that allows for pharmacists to prescribe certain products like prenatal vitamins, oral contraceptives, post-exposure prophylaxis. And so we're really looking at, this stepwise process to possibly move into that, again, making those pharmacists, not taking away from anything else, but making those pharmacists who are so accessible more available for some of the additional needs of the communities as well.
Awesome. I just love hearing about the More Than a Script program and the access that it has. So thank you for that little sneak preview that you gave us. Lastly, we did get a few questions regarding the engagement center that Teladoc Health showcased and how to access that. So I posted that link earlier in the chat. I'll include it again in the follow-up email as well. If you need access or you aren't sure if you already do or not, you can reach out to your Blue Cross North Carolina account manager and they'll be more than happy to help you. You can follow up in the survey if you have any questions about that, but be happy to help get you that access that you need. All right, and we do have one more question that just popped in. Give me just a second, let me read it through. Can any employee sign up for weight management and receive a scale and or the blood pressure cuff, or do they have to have an elevated blood pressure? Fran or Lauren, I believe that is for you.
I can take that, Fran.
Okay, Lauren.
They would need to have, you would need to have a qualifying condition as part of the larger suite. So depending on which program we're launching, if it's the full suite that Fran showed earlier with all of the options, they would have to have either hypertension, diabetes, or or qualify for the prediabetes program in order to access weight management. That is how it's set up today. So for the hypertension plus program we're talking about, yes, they would have to have hypertension in order to access weight management.
All right, thank you for that. I appreciate that clarification for that. All right, so that is all the time that we have for today. I want to thank everybody again for joining us, particularly our 3 presenters. Please keep a lookout for that post-webinar survey that we have for a chance to win an Amazon gift card. We are still finalizing the details for March's solution spotlight. I will pop that here in the chat. We're going to focus on travel benefits with Blue Card and Global Core. As we ready those final details, you can go ahead and register just to get those on your calendar, and you'll be notified if there's any changes or updates made to that. Brendan, Lauren, and Fran, it was a pleasure having you join us here today. I hope everyone has a great rest of their day. Thank you again for joining us. Bye, y'all.
Thanks, everyone.